We'll start here in the United Kingdom, which has hit another record high for daily COVID cases, with over 180,000 reported in the last 24 hours. But there is growing frustration over supply issues with lateral flow tests in the UK, and more people are lining up for PCR tests at various centres.
The issue that we have at the moment is that people are going into pharmacies to collect the lateral flow tests for which they have generated a code online, and therefore they are unable to access those lateral flow tests because we simply don't have them. I think the message to the public really is that generating the code does not mean that we have one there sitting ready for you. It's just generating the data nationally so that we know who's collecting them, and it's really important that people, when they do collect them, put that data online as well, and let fill in that form to make sure we're aware of how many are getting negative and positive results.
The case surge has started to translate into more people ending up in hospital. Over 10,000 people were in hospital with COVID in England as of Wednesday, up 48% from last week, and the highest number of admissions since March the 1st this year. The British government's now asking hospitals in England to identify sites to set up around 4,000 emergency beds to deal with a potential impending wave. But New Year's celebrations will go on, with Prime Minister Boris Johnson urging people to mark the turn of the year in a careful way.
And I'm sorry to say this, but the overwhelming majority of people who are currently ending up in intensive care in our hospitals are people who are not boosted. I've talked to doctors who say the numbers are running up to 90% of people in intensive care who are not boosted. If you're not vaccinated, you're 8 times more likely to get into hospital altogether. So it's a great thing to do. It's very, very important. Get boosted for yourself and enjoy New Year sensibly and cautiously.
Our correspondent Laura Makin-Isherwood is joining us now, live from London. And Laura, the National Health Service in England is building a series of so-called Nightingale surge hubs. What will their role be?
So these are going to be set up at around 8 sites at the moment across England. So hospitals that already exist, that are already taking COVID patients. But these are sort of an extra area of capacity for each of them of around 100 beds to start with, in case they do get an influx of COVID-19 patients who might need some significant treatment for their illness. Now, of course, the NHS, sort of National Health Service bosses are saying that this is basically an insurance policy, a sort of backup to the current space that they have in their hospitals, just in case. But of course, with the sheer volume of coronavirus infections that are being recorded in the United Kingdom day on day, that means that health chiefs really want to make sure that they have that spare space to treat people should they need it.
And the English New Year festivities will largely go ahead without restrictions, won't they? But that's not the case in Wales, Northern Ireland and Scotland. How's that going to work?
No, absolutely not. And the governments of Northern Ireland, Scotland and Wales have all made their own decisions on bringing in restrictions ahead of New Year. They're putting in place limits on the number of people that can attend restaurants together, maybe up to 6 people. So moving back to the experience that we had here earlier on in the pandemic, at the start, before the vaccination programme was rolled out, to try to sort of slow that spread between friends and families when they're sitting together in close proximity. They're also putting limits on indoor events that are seated. Around 200 people there can sit down, and also on outdoor events as well as sporting occasions, trying to limit those mass events where multiple people are being brought together, where perhaps the virus can spread quite quickly. Here in England, though, the Prime Minister Boris Johnson says that the data currently doesn't show that new restrictions need to be put in place. Of course, he's having to balance the needs of businesses and the rest of the economy as well there, trying not to bring in any further lockdowns without it being really, really necessary, to try to sort of prevent that damage being placed on the economics of the country. He's also saying that the Omicron variant of COVID-19 doesn't look to be as severe as the Delta variant. That's after analysis that was done by South Africa and the United Kingdom. The World Health Organization, though, is saying that there is a real risk, a high risk, from the Omicron variant of COVID-19 as it becomes the most dominant variant in many countries around the world now. But in England, the Prime Minister Boris Johnson says that a booster jab is the way forward, getting vaccinated, and he's urging everyone to take up that offer.